It's estimated Connecticut is spending more than $65 million a year on treatment for opioid dependency. Governor Daniel Malloy is trying to get a handle on this. He unveiled a statewide plan which focuses on increased access to high-quality medication-assisted treatment. News 8 medical reporter Jocelyn Maminta has the details.
And a strategic plan was commissioned by Governor Malloy. It is a blueprint designed to expand what is already in place and help guide the fight against opioid addiction and overdose.
It's midday. An all too familiar case is brought into the emergency department of Yale New Haven Hospital. A patient is rushed in after an opioid overdose.
So while they're here, we not only treat their emergent condition, we observe them, but we also start treatment such as with buprenorphine if possible, or we directly link them with a facility.
Access to evidence-based care, medications, and counseling are among the key initiatives in a statewide plan aimed at the opioid crisis in Connecticut.
The most effective treatment strategy for opioid use disorder are medications such as buprenorphine and methadone, along with counseling. And what we need to do is work with providers throughout the state to make these treatments much more readily available.
Yale researchers Drs. David Folline and Gail D'Onofrio helped craft the blueprint.
What this strategic plan is helping us is to get treatment everywhere.
That includes getting the life-saving medication naloxone, also known as Narcan, which reverses opioid overdose into the hands of more people fighting the addiction. Another element, educating providers and the community.
So we are going to focus on working with the physician community and providing routine trainings. Our goal is to have training every other month around the state.
The emergency department plays a pivotal role, they say. This is where people with addiction seek help. This one is among the most proactive and is seeing success.
We have been like the test case here, and now we want to bring it and spread it out to the entire state.
Other recommendations included reducing the overdose risk, especially among those who are likely to relapse. The underlying message here is that addiction is a disease, and like other chronic conditions, there should be a plan of action in treatment and prevention. The governor says funding is not immediate, but is asking impacted state agencies to look into how best to use state resources to implement the recommendations. Anna Scott.